Happy day to all. Welcome to Physiotherapy Competitive Exam Series. Contact details for license exam crash course are given in the description. Which brain region is likely injured when a patient with traumatic brain injury shows difficulty in initiating task during rehabilitation? A. Frontal, B. Temporal, C. Parietal, D. Occipital. The correct answer is A. Frontal lobe. Frontal lobe controls initiation, decision making, and motivation. Damage leads to poor initiation, often seen in traumatic brain injury. Temporal lobe is involved in memory and auditory processing. Damage affects memory and language, not initiation. Parietal lobe processes sensory information and spatial awareness. Occipital lobe is primarily responsible for vision. Damage affects visual processing and not initiation. Following a stroke, a patient exhibits limited shoulder abduction. Which nerve should be blocked to determine if restriction is due to muscle overactivity or a fixed contracture? A. Spinal accessory, B. Musculocutaneous, C. Thoracodorsal, D. Dorsal scapular. The correct answer is C. Thoracodorsal nerve. It controls latissimus dorsi, opposes abduction, making it key for diagnosis. A. Spinal accessory nerve controls the trapezius, affects scapular movement, not abduction. B. The musculocutaneous nerve controls biceps and coracobrachialis, involved in elbow flexion and not abduction. D. Dorsal scapular nerve controls rhomboids, stabilizes scapula but is not involved in abduction. A 47 years old man experiences shoulder pain and difficulty lifting his arm after falling on an outstretched hand. He is unable to start lifting his arm to the side, has weakness in external rotation, and reports tenderness beneath the acromion during examination. What is the most likely diagnosis? A. C5 root injury, B. Fractured clavicle, C. Rotator cuff tear, D. Suprascapular nerve damage. The correct answer is C. Rotator cuff tear. The key features say inability to initiate abduction, which is supraspinatus, and weakness in external rotation, which is infraspinatus, with tenderness under the acromion. Other options are less likely because C5 root avulsion causes radiculopathy and not isolated shoulder symptoms. Clavicle fracture presents with deformity, not isolated weakness. Suprascapular nerve injury is rare without direct nerve trauma, less likely than a tendon tear. So C. Rotator cuff tear is the right answer. A patient presents with difficulty in speaking, understanding language, and repeating phrases, but their speech fluency remains intact. Which area of the brain is most likely affected by a stroke? A. Precentral gyrus, B. Temporal gyrus, C. Arcuate fasciculus, D. Cingulate gyrus. The correct answer is B. Temporal gyrus. It contains vernix area, which is crucial for language comprehension. A stroke here can impair expression, comprehension, and repetition, while fluency may remain normal. A. Precentral gyrus is not correct because it is involved in motor control. A stroke here affects voluntary movement, not the language functions. Arcuate fasciculus is not correct because it connects Broca's area and vernix area. Damage here causes conduction aphasia with impaired repetition but normal fluency and comprehension. D. Cingulate gyrus is not correct because it is involved in emotion and cognition, not directly in language processing. I hope this video would have been useful to you all. For more such videos, stay tuned to our channel. Thank you.